Good morning, I'm Dr. Deuk Laser with Duke Spine Institute, and I have one of my lovely patients here with me who's traveled from
Maryland.
Maryland. Yeah, I knew that, but I wanted you to say it. And where are you headed back today?
We're going back to Maryland to
Okay.
my house there to see my grandchildren that'll probably notice how well I'm feeling and how much better I look. And it's all due to Dr. Duke.
Well, a team of people, and I appreciate that. So why did you come here from Maryland? Why did you come to Duke Spine Institute?
Because I had fusion surgery over a year ago, and the pain was worse after the surgery than it was before. And I just had no quality of life, and I was in constant pain. And my husband researched on the internet and found Dr. Duke, and we came to see him, and he performed the laser surgery on me, and I'm 90% better in one day.
That's wonderful to hear. And the pain that you had down below your fusion, how much of that pain is gone?
About 85–90%.
It's wonderful news. Now, did you have any leg problems before the surgery that we did yesterday?
I have Parkinson's disease, and I think I had some weakness from that, but no pain from my back.
Okay.
I had a little numbness in my rear end, and that's completely gone too.
All right, very good. Anything else you want to say to the audience of people out there that are suffering with back pain like you did? How many years did you suffer with pain for, by the way?
Oh my gosh, at least 5.
At least 5, okay.
I used to be an avid exerciser, swam and did dance aerobics, and I couldn't do any of that for the last year and a half. And I'm really optimistic about getting back to it. So if you have pain, come see Dr. Duke, he'll fix you.
I appreciate that. And what kind of pain meds are you on after your back surgery that we just did, the laser surgery?
I've taken a small amount of muscle relaxer and 1 pain pill.
1 pain pill and maybe 1 or 2 muscle relaxers.
Yeah.
And pretty much.
And I don't think I'm going to need more than 1 a day. Just maybe when I'm traveling today, so I'll probably take 1. But other than that, I'm going to wean off of them as fast as I can because I've been on them for years.
Yeah. So one of the nice things about the endoscopic laser surgery that we do at Duke Spine is that there's no powerful narcotics, no opioids that we use in our patients. After the surgery is done through a tiny incision, and patients just need an anti-inflammatory for maybe 1 day, and then they're done.
I went to dinner last night and had a nice meal and enjoyed it.
Good. I'm so happy for you guys.
Me too.
All right, well listen, make sure you send us a postcard.
I will, no problem.
All right, you take care.
You too.